Hello, everyone. My name is Kayla Keeney, and I am doing my case presentation on cellulitis. The patient is a 68-year-old white male who is in the hospital accompanied by his wife. The symptoms the patient presents are swelling in his left leg, pain, redness, warmth, and recently had cellulitis a year ago and was treated with antibiotics. The relevant history is the patient was admitted a year ago with cellulitis of the left leg and had to get antibiotics for 6 weeks with a PICC line. He's a type 2 diabetic, eczema, and obese. The physical findings were that the patient had his left leg elevated on 2 pillows. He showed that he had redness, swelling, and warmth at the site. The patient reports 8 out of 10 pain and had the same infection a year ago. Lungs were clear, abdomen soft, positive bowel sounds, no other skin concerns. Patient reports baseline independent, but has been using a walker for the past week to ambulate. The diagnosis would be cellulitis. He's having pain. He's has swelling, redness, and warmth at the site. The patient had this infection a year ago and had to be on antibiotics for several weeks. The diagnostic testing would be doing blood work that would entail like a CBC, CRP, and 2 sets of blood cultures, just in case if there was anything contaminated, they can see which one grew back if it did, if there's a bacteria. This will allow us to determine, again, if there's any infection and which antibiotics can help treat this condition. An ultrasound could be beneficial to rule out DVT in his lower extremities just because of the warmth, the heat. So that would be helpful. The way to treat this, there are several things that we can do for this. One could be using Tylenol and NSAIDs that can help with the pain. Another thing is to elevate the foot with 2 pillows, which he's doing. Antibiotics could be started, and depending on how severe the patient could have it IV or PO. A lot of times when patients are admitted to the hospital, they start with IV antibiotics and transition home to PO antibiotics. Wound care could be beneficial for the patient and marking the site, making sure it's not spreading. And a consult for dermatology can help monitor the patient's site and recurrent infections as well. This patient just had cellulitis a year ago, so we can just work together with other disciplines to make sure that this doesn't keep happening. We don't want it happening every year. We can figure out what we can do for him. And these are my references, but thank you so much for listening.